Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
I'm learning. Okay.
Well, I think the only dangerous answers are either going back to sleep or driving, because it's a concern that if you have chest pain, that the cause could be cardiac, in which case the coughing is not a bad idea. But as long as you're doing that, along with calling 911, so that you have. Nowadays, they do have a treatment that can dissolve some of the clots and also get emergency stenting, so that it is now treatable. On the other hand, if you think you have indigestion, it turns out to be a heart attack, and you don't do anything, then you are likely to die. And so it's better to be embarrassed by finding out that you have GERDs or indigestion than to die and not know, one or the other. And yes, John?
Yeah, I had a case. I was in my classroom, and my chest started to flutter. It's like it's almost, it almost felt like arrhythmia or something like that. But and I was so nervous. Yeah, I was so nervous. I called Kaiser, and I was holding the phone like this for like 20 minutes, waiting to hear from Kaiser. Then when he picked up, they said, "Well, is your left arm numb?" And it was, because I was holding the phone for 20 minutes, right? So they said, "Go to the hospital." So I went down to the office. I said, "Look, I'm having chest pains." He said, then he said, "Don't drive." I left and drove up to Holy Cross Hospital, but it turned out to be high blood pressure. But it wasn't a heart attack or anything. Thank goodness. But I didn't know I had high blood pressure until that time. So from that point on, and they kept me for like 6 hours to make sure that everything was stable.
And the concern about driving is that you could die en route, and that's why they want you to get call an ambulance, call 911, so that if something happens to you en route, they can treat you. They can resuscitate you and do whatever is necessary. So, any concerns?
Could you take an aspirin?
You can take anything you want on the way in the ambulance on the way.
Yeah, on the way.
You can if you like. Aspirin's not going to hurt you.
It wouldn't help. I thought
No.
they said the aspirins help.
It's not going to help coronary artery thrombosis.
Oh, okay.
You take the aspirin to prevent that.
Yeah, I know, but I had heard one time they were saying that you should take one if you felt like you were having a heart attack.
That isn't going to help you very much, but you could take an aspirin. It's all right. It won't hurt you, but it's not likely to help you.
Okay.
Any other thoughts about that? I know some people think that chest pain is nothing to worry about, but it's life or death. Many people have actually just dropped dead,
So when you call
chest pain is one of the most serious concerns you can have. What'd you say?
So when you call 911, what do they do? Send an ambulance for you or something?
Yes, absolutely. Yes. Just like if you have symptoms of a stroke, if you suddenly go blind, or if you suddenly have the inability to speak, or suddenly have a drooping on the side of your face, these are signs of a stroke. And the same treatment that they use to dissolve the clots for the coronary artery disease, they also do for a stroke. And both of those are situations in which you need to be taken care of immediately, because with every minute you lose about 1 million brain cells with a stroke. And with and the sooner you can get treatment for a stroke that is caused by ischemia, the better off you are. And the sooner you can get treatment for coronary artery disease and thrombosis, either a stent or a dissolving clot, the more likely you are to survive. When an
Dr.
area-
Callender,
yes.
yeah, I have a question. The question is, if you have somebody in your house that's trained in CPR, can you can call 911 while you're waiting for the ambulance to get there? Is that correct?
Oh, yeah. Yes. 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 Usually when you tell them you have chest pain, they'll get there as quickly as possible. But if you have somebody who is experienced, you can wait with them for the ambulance. Any other thoughts or concerns about the answer I gave you?
Well, when you lose 1 million brain cells every minute, I just looked up how many brain cells does an average human have, and it's 86 billion.
Wow.
Interesting. Yeah. Yeah. So there are more, there was an article that talked about, are there more brain cells or are there more stars in the sky? And apparently there are more stars in the sky.
Yeah, Darryl, are you suggesting that you can afford to lose
No,
1 million brain cells?
no, he was not suggesting that. He was just giving you accurate data, that's all. But think about 1 million brain cells a minute. That's after an hour, you not much left. So, okay. The other thing we talked about last week was about the relaxants and hair straighteners, their relationship to breast cancer, and actually to ovarian cancer as well. But there's also data that indicates that those relaxers also give you 4 times more likely the incidence of uterine cancer as well. So that, and they mentioned in those articles, as you had mentioned, that they think that it is more prevalent among our group because our women tend to use the straighteners and hair relaxers more than other groups. Is that accurate? That we use it more than other ethnic groups?
I think so.
Yes, we
I
do.
think,
Probably.
I
Our
think
hair's
so
more
because,
curly.
yeah, I think so because we were trying to be more culture conditioned to the other, the straight hair. I think that's what it is. We were always told about our hair and, how it is so curly or kinky until we discovered that the curly and kinkiness of the hair is one of the virtues of having our hair and how versatile it is. And that's when the natural hair movement just decided to blossom. I think after a Chris Rock movie called Good Hair, when he was doing that movie regarding perms. And I think that's, as I said, when the natural hair just kind of blew up and made people realize, hey, I can do something differently with my hair. And that's what I think we were just doing straightening and perms for so long, just trying to, get cultural conditions to straight hair.
Well, I just say it wasn't always cultural condition. You couldn't get a job if you had an afro or braids. Even in the military, it was for women particularly. I remember counselors would tell young ladies when they would go for interviews, you cannot go unless your hair is in a certain way because they will not hire you. And there was a law. And even in District of Columbia, you could not have braids and apply and work for the federal government. So it wasn't just a cultural thing, it was a way of getting a job and surviving. So our hair had to look straight. And you could not go out, especially when the 60s and afros came in and all that kind of stuff. That was just for a while. So Black women, we were been conditioned to have perms because that was much easier for us to have a perm with all that lie and everything than having your head burned up by being straightened. Because you got tired of being burnt.
That's true.
And
Well,
then we lost our hair because you put too much lye on it. Then you end up, like I had a bad curl one time, a Jerry curl, and I went out and lost half of my hair, well, 3/4 of my hair. And a girlfriend said it looked like the cat sucked on it because it was so short. But, you know, we lose our hair, we go bald, then we put on wigs and etc. And that is so we could maintain our jobs, our
Please hold the front desk. Ladies, please hold the front desk, please.
Yes, you're right, Carol. And from a very young age, you know, we always had the straightening comb, like you said. And perms were much easier as we got older. But I do it now because I can't get a regular comb through my hair unless I put something on it, a straightening comb or lye or something.
Right. And you're right, it was a way of life. I know in my family, all of the females, no chemicals, no perms, from the olders, my sisters, as well as the nieces. But guess who was getting a perm? However, I've stopped Carol.
Yeah, well,
I'm no
I have.
longer getting my perm. So
I
we'll see how
gave
that.
myself one this past Saturday, so I have not stopped. And I've been
got a
doing it since the 20s.
Right, you're conditioned to do that. It's
But I don't leave it on long.
based on appearance and what you're used to. So I haven't in a few months actually.
No.
But
Religion.
anyway, we'll see how it goes.
You can't get a job as a TV anchor unless you have a perm.
But now it's changed. Our day of time has changed and we're slowly rolling, and the younger and the laws have been rewritten. So we can have our hair in any way that we want. And the natural is really coming in, and it's just what you're getting used to. And I'm slowly like getting gray hair. I was conditioned. I didn't want to see it. And I kept dyeing it, but then I found out that dyeing hair is bad for you just as well. So it's what you condition and what you're free and comfortable. So one day I would be like my friends, Sylvia and all of them, and just be free and and I've done it a couple of times, and I used to have a fro and curl, and so I'm slowly ebbing to that, but I have to see how the gray hair looks like that. Some people, it looks beautiful. So I'm slowly going, and I hope I'll reach there before the end of life.
Well, there isn't a whole lot of data that says dyeing is as dangerous as the relaxant. So dyeing is less dangerous than relaxant.
Well, not all dyeing. Most commercial dyeing products are dangerous and have dangerous chemicals, except for natural organic henna. The roots of henna go back to ancient civilizations. The Egyptians use henna. If you look at Egyptian hairstyle, henna was a major part of their makeup. But when we talk about natural hairstyle, it's quote natural, because if you have an afro, you pick it out, you comb it. And kinky hair is not designed to be either combed or picked. Natural hairstyle for kinky hair is you don't comb it or pick it, the hair locks. And when it locks, it doesn't need to be cut. Like you look at all animals on the planet, they don't cut their hair with the exception of sheep that are bred for their wool. They're bred long hair, and so that hair has to be cut. Other than that, cutting is, animals, they'll shed feathers, fur, whatever. But as far as cutting, natural hair is good to go. Some of the advantages of natural hair that we don't recognize is that the hair, Kinky hair is hair that's basically flat. You have Caucasian hair that is oval. You have Asian hair that's almost totally round. The more flat it is, the more the hair curls. When it curls, it doesn't lay flat against the skin, which means that you get airflow. The advantage of kinky hair is that the airflow keeps it doesn't the hair doesn't lay against the skin. You get airflow, and so it keeps wherever the hair is, it keeps it warmer in cold climates. It keeps it cooler in hot climates, and so it's
Yeah.
it as far as temperature control it works the absolute best.
That's John Tatum.
Okay, go ahead. Yeah, go ahead, Darryl.
Okay. Well, like I say, one of the amazing things, like once you train, you can train your hair by combing it, by picking it, by hot combing it, by permanent. And when you train your hair, you can train it to lose a lot of the curl. And when you do, you're going to have to be in a position to cut it, to trim it. Black women spend more of their income on hair care than any group in the world. And it's like it's a drain on your personal economy, on a group economy, and on the health, with all the downsides that the chemicals that we put in our hair, what they do with the cancer outcomes, endocrinological outcome, adverse outcomes. And so it's like we don't love our hair. We've been trained and conditioned not to love our hair, to think that good hair is straight hair, and we don't recognize the advantages and also the downsides of straight hair, as opposed to the hair that we were born with.
Very interesting topic. Yes.
Story. When I was in my 20s, I guess my late 20s, my girlfriend put a perm in my hair, and it burned. And I think that was the source or the beginning of my baldness, my male baldness. And I had a Jerry curl at one time. It was a carefree curl, and it looked pretty good, but I started going bald right at that spot. So that's the result you see right now. That's so.
But there was an age group in the 50s and 60s where men, what we call conk, they conked their hair, and the stars and everything. I forgot what it was, that famous singer that he had a conk all the time. Nat King Cole did for a while. And
Sammy Davis.
And Sammy Davis. All of
Little Richard.
A whole lot of them.
A lot of them. And because that was a style, they were able to make it in the music industry because of that. So
your cousin.
Huh?
Your cousin.
Yeah, my cousin.
Charles Edward.
So that was the style. Men did it, but men must be a little smarter because they stopped. I think it's just a couple these days, but they stopped doing that. And men, their hair is natural. The women, we had to hold on to it because if we wanted to work or anything like that, the society didn't hold men to the line like it did the women.
Another advantage of kinky hair is that it goes up. Straight hair falls down. When it falls down, it can fall into your eyes. You have to trim it. It gets in the way. So another advantage of, we all human beings started out in Africa with kinky hair, dark skin, and there's been some evolution along the way. But most of us are looking like God originally made us. And there's some advantages of that. Some of the evolutionary changes have been environment. Some of it have been close sanguinal breeding. You have like a lot of islands where there's cousin breeding just because they don't have the diversity and mate selection. close sanguinal breeding will straighten the hair just as a genetic outcome of that. But it's like going up.
I
All
don't want,
praises go up to God.
yeah, but I don't want my hair going up, but okay.
Oh, okay. Another issue that we talked about for quite a while is sitting, and the fact that it's a habit that is associated mostly with watching television and the lack of exercise. But sometimes we don't appreciate the fact that sitting also contributes to dementia, and that it is one of the greatest hazards of sitting. Of course, there are many hazards of sitting, and they say sitting is like smoking because it has so many disadvantages. But we often don't talk much about the fact that it increases dementia. Any thoughts about that? Any thoughts about changing your sitting postures and exercising every 15 minutes to avoid the negative effects of sitting?
Yeah, I thought about having the whole group stand up at least once an hour while we're having our session, because sometimes we're here for 2 hours sitting.
Should be every 15 minutes or so. Actually, at least do repeated exercises.
Well,
Okay,
my comment.
everybody stand, on the count of 3, everybody stand. 1, 2, 3.
And do your pedal exercises. That muscle in your calf is like the heart muscle for the leg. Remember, Dr. Ivy taught us that.
Yeah, stretch
I'm
those-
thinking that television watching is a major cause of sitting.
Computers
Yeah.
is the major cause.
Yeah, it probably is. Yeah, they go hand in hand.
Yeah, yeah.
Okay, John, I guess
Wow.
we can start the
I'm
slide.
glad my husband walked in right now. Say what you said again about every
Sitting.
15 minutes getting up, Reverend Dr. Callender.
Well, I think that there's very good evidence that the calf muscles exercise and keep the blood circulating. So about every 15 minutes, you should do either pedal exercises or, as you said, get up and down. Doing the pedal exercises with the calf muscles acting like the heart for the venous circulation keeps your body flowing and keeps the blood flowing, circulating, and prevents clots and is healthy.
And
Where
causes
sitting
dementia.
contributes to dementia and other things that are not healthy.
Thank you. I wanted my husband to hear that. I don't know whether it's going to resonate, but I wanted him to hear it from a doctor.
Right. And as Darryl said, TV contributes dramatically to the sitting, and sitting is not good for you. Now, this is an article that I thought that was of great interest to us, since many of us are in the category of the senior, and some of us are in the elderly situation.
Mm.
And so the question is, should you risk major surgery? And of course, this study looks at people who are 65 and older, and looks at the morbidity and mortality rates of people who are older than 65, people who are older than 80. And it talks about the conditions that make you wonder. If you're 90 or older, you have 6 times likely to die after surgery than if you're 65 to 69. And of course, what we're talking about is a field that is not developed as much as it should. Is geriatric surgery, which is surgery of the older, of seniors. We talked about, we've had Obesis on talking about geriatric medicine, but there's also a special place for geriatric surgery, for surgery of seniors. And we're talking about situations like frailty, in which you either have lost weight or you're not exercising, and your muscle strength is weak. And so that for many, if you are frail, it's advised that you not have surgery until you have exercise and you are no longer in the category of being frail. Because people who are older than 80 and people who are frail are not likely to survive surgeries. And those people who fit in that category, sometimes they have to be gotten into better shape before they actually have surgery, or either they do not recommend surgery at all.
Dr.
in fact-
Callender,
Yes.
I was just thinking like, okay, you talk about seniors, with, being fragile. Before surgery, does the doctors, suggest taking like a bone density test and just to see where you are in terms of your bone structure?
Well, actually, bone density is not a major part of the diagnosis of frailty, because frailty really means are you able to walk around? Do you exercise? Of course, if your bone density is low, then you're likely to get fractures. But frailty is more about the fact whether you are, while you're old, whether you're a healthy old person or somebody who's not in good health. And so bone density will tell you about the condition of your bones, but doesn't necessarily tell you about whether you're fragile or not. And frail is a condition that we now know is not associated with good survival after surgery. So that if you, in point of fact, are not eating well, if you're losing weight, if you're weak, you're not exercising, and you fall in the category of fragile, then you need to have physical therapy and get away from the fragile state before you have surgery, or not have surgery at all.
Dr. Callender, what are the categories? Like you said, fragile. I know at one time they had rated my parents. I can't remember what they were.
The category of fragile means that either you've lost weight or you're you're not exercising, and they do special tests just to see the ability to walk around. And if you found that you've lost weight, that you are not able to get around, they then consider you as fragile, and they therefore do things to get you out of that category before you get operated upon. If your mind is not sharp, if you're losing weight, if you're weak, then they put you in the category of fragile. And fragile is a category that when you get into that, you should not have elective surgery if you're fragile.
Right.
Emergency surgery is another thing. But for elective surgery, if you're fragile, then you should no longer be fragile when you have surgery. And the key category of fragility is whether you lost weight in the last 3 to 6 months, whether you exercise, and whether you get around on your own.
Okay.
And I think that this is something that we had not recognized up until the last 10 years or so, to realize that it's not the aging itself that is as much a problem as it is whether you fall into the category of being fragile.
Yeah, they had rated my father as being robust one time.
Yeah, robust is a good category. That's the category you want to be in.
What other categories do they have?
Well, those are the only category.
Those are the only two.
Really, fragile is the one that is the contraindication for you having elective surgery.
Yeah.
Yeah, and if you fit into that category, then you don't get elective surgery. If you need emergency surgery, then what they do is they operate on you and then they try to get you away from that fragile situation by giving you more protein and building you up and giving you physical therapy.
Dr. Callender, what about muscular atrophy?
Muscular atrophy is part of a fragile state, and and when you have you don't exercise, you will automatically undergo muscular atrophy. As you age, you undergo muscular atrophy. So that is the category of fragility or frailty. And that's why exercise is so important. And as you go down this article, you see that there's a category of people who are over 90 who want to have surgeries because if you find out that you have a cancer, which is more dangerous, for you to have the surgery or you to have the cancer? And the answer to that question is determined by whether you are active, whether you're exercised, whether you're eating, and whether you're out of the category of fragile or frailty. And as you said, your relative was regarded as robust. That's the other category. But the one category that says you shouldn't have surgery is if you fall in the category of being fragile, especially in the over 65 population. When you're over 90 and you're in the elderly situation, then it becomes even more important for you to have exercise and not to be losing weight, not having muscular atrophy.
Dr. Callender, you mentioned to us a case where a lady was over 90, I believe, and the question was whether she should have uterine surgery or not, cancer removed from her uterus. Do you remember that case?
Yeah, and the answer is really, if they have a cancer, then you can have them undergo physical therapy, have them eat and give them protein diets to try to get them away from the category of fragility. And when they are not fragile, that's the time that you can proceed with the surgery.
Dr. Callender, my mother developed breast cancer at the age of 90. And we talked about getting surgery, and she went and got surgery, and she lived another 4 years. She didn't die from breast cancer, but it never even occurred to us that she wouldn't have the surgery. She had we thought it was just a scratch on her breast, but and they watched it for a couple months, and then they got a biopsy and found out it was cancer. So they removed the lump, but she did very well in surgery. She healed well, and she actually forgot that she had the surgery after a few months. So I think it kind of, when they put her under, I think that it took some of her memory. I think maybe it pushed her into dementia. Do you think that happens?
Yes, there's a lot of data that suggests that for some seniors, when they undergo surgery, it does interfere with the cognitive aspects. And it is reported that some people after surgery are not the same mentally as they were
Right.
before surgery.
Right.
So as you get older, one of the things that I think there's another article that talks about eating healthy and so many advantages to eating healthy and exercising that puts you in a better situation to undergo geriatric surgery. And that's what is called geriatric surgery. And one of the things that they do evaluate is your mental state, your cognitive state, to see if you are delirious or you have dementia.
Would Dr. Callender, would that surgery that she was talking about be elective, or would that just be that with the cancer? Would that be something?
Cancer surgery gets into the category of elective surgery. But when you're talking about a cancer that is going to kill you, then you need to decide on which is more dangerous, the surgery or the cancer. And if you're eating healthy and you're exercising, then the risk of surgery is not as high as if you are frail. And I think that's the category that you want to avoid being in, which you can be by exercising and keeping your weight stable.
I know my mother too had surgery, but hers was, I guess, had to be done. She had an aneurysm in her stomach.
Well, that's emergency, right?
And she also had blocked arteries, so they had to do the heart first and then come back and do the aneurysm. And she was like 89 and 90 when all that was done.
And she survived that?
Yes, yes. And even after that, she had a fall and broke her hip, I think at 92 or 3. She survived that. She lived till almost 98. So.
Some people you can't kill, huh? Yeah, it's amazing. She went through all the things that older people consider hazardous, and survived it all. That's amazing. Yeah. Any other questions about having surgery as an elderly person? You know, diverticulitis and the complications of diverticular disease becomes a very emergent issue and has to be treated aggressively. So it's good to stay in and to eat healthy, as we talk about, and to exercise and meditate appropriately, so you're in the best shape you can be.
I'm thinking seriously myself now about having back surgery. I have a pinched nerve in my back, so.
It's painful, and so many of us have that kind of problem. And so the best thing to do is to eat well and exercise, so that when you have whatever surgery you have, you can successfully survive it.
Dr. Callender, I know it's not stated here, but I don't know why it's in my mind, that the more weight you have, the better you are as far as surgery, or because they were saying she's wearing skinny jeans, as if being thin makes you frail, rather than if you have a little bit of what they say meat on you, a little bit of fat will help you sustain surgery more. Is that true, or just something that's misconceived?
Well, the truth of the matter is that the category of fragile or frailty means that you've lost weight over the last 3 to 6 months. So, they don't talk much about being obese and those kinds of things, because not too many elderly fit into that category. So that as long as you're not losing weight, that category of fragility is that you're losing weight over the last 3 to 6 months. And that implies that your metabolism is going in the wrong direction, and that needs to be corrected before you have any surgery. So it doesn't speak to whether or not you come into it overweight or underweight, but it does speak to the fact that over the last 3 months or so, whether you have been losing weight. And it doesn't talk about the category of the obese patient, because we already know that the obese patient is more associated with complications than the patients who are not obese.
Okay. My sister has been losing weight. She really should be in the category of obese, but she's been losing weight probably for the last year. And
Is it intentional?
no, she says she really isn't trying to, but she says her doctor says she's fine when she goes, but she has been losing weight, but she really was, overweight. So maybe they think that she needed to lose the weight. I don't know.
Yeah. She, if she was morbidly obese, was she morbidly obese or just
She
obese?
probably was up to what, 250,
Shoot.
300?
350.
Yeah.
Yes, so she's morbidly obese,
So
which is not healthy.
and I guess as she ages, losing the weight is a good thing.
Yeah, yeah. If you're morbidly obese, absolutely, yes.
Okay. That's good.
Any other comments or questions? We go to the next slide. Now, I thought this was an article that refers to something that Mr. Buchanan talked about in terms of his observations as he was doing his deep sea diving and looking at the Great Barrier Reef, which is thought to be the basis for the livelihood of the fish industry. And there's evidence that things are not as healthy as they used to be. And of course, the bigger fish eat the smaller fish. And if the smaller fish aren't there, then that's going to be a problem. John, did you want to make any other comments about the barrier reef?
Well, I haven't been there, but the reefs that I've seen, that I've revisited, they've been degraded, and that's I think from global warming. So how this could affect all of us is, focusing a little bit more on recycling and using less energy, and just trying to be more sometimes the things that go on in our lives cause us to be so self-centered. But when you look at even look at the Potomac, all the trash that's in the Potomac, is kind of brings it to up to the forefront. All the plastic and everything that we use, all that affects the reefs all over the world. And
Well, don't go back up to that paragraph that says, if the Great Barrier Reef is in danger, then every coral reef in the world is in danger.
yeah.
And so, which goes back to the point that you were making, that we need to rethink a lot of the things we're doing, or is it too late?
Look at the quality of that reef right there. That looks terrible. It looks like dirt, where it should be vibrant colors and yellows and greens and blues, all kind of it looks like a wasteland. And that's where, like you said, the tiny fish eat the coral, and the medium-sized fish eat the tiny fish, and and we end up eating the big fish.
Right.
So it's something that we can start to think about as far as, like I said, recycling and our use of energy, electric vehicles, things like that.
Bad commentary. Are we doing enough about climate?
No.
I remember when we started talking about this about 20 years ago. Nobody listened. Now, people are listening, but is it too late, or are we willing to change? That's the question.
One major thing that we could all do for climate is to stop eating meat, because that adds carbon dioxide to the air that changes the atmosphere and promotes global warming.
Okay, next slide, please. This is an interesting article because up until now, sexually active gay men cannot donate blood. And the question is, if they are HIV negative, is there a reason why this should be the case? And so as they're looking at more and more studies, they're trying to identify tests to make it possible for gay men to, healthy gay men to donate blood. But right now, that is not the situation.
Yeah, I'm a famous blood donor, 100 donations. And every single time I go in to donate, I have to answer all these questions, a series of questions. And a bunch of them are about, having a partner of the same sex, male or female. In fact, I'm supposed to go in, I think this next week to donate. But if there's any change in that series of questions, I'll definitely let you know. But they definitely banned.
Yeah. Well, many people have gotten HIV from blood transfusions. That's why it started in the first place. Remember, Arthur Ashe got his HIV from blood transfusion, and that's when it started. Yeah.
So they're saying gay men, but like John just said, what about gay women? Are they allowed to donate?
As far as I know, I know about the gay men. I don't know the situation about the women. Do you know, John?
I think on the survey, it asked if you had a partner of the same sex. So I think that covers both.
Right.
Okay.
So it's going to be interesting to see when they're talking about changing.
No, we didn't talk there. She on Zoom. All righty.
Okay, next article. Now this is interesting because this year, every year they change the flu vaccine. And this is one of the first years I've read where there's a good match. And so it's really advisable this year to take the vaccine, because I think last year, although the vaccine was available, it wasn't as effective. It was only about 50% effective.
Okay.
But this year, it looks like this is a good year to take the vaccine, because the antibodies are affecting the virus that's out there. So if you haven't got your flu vaccine yet, which you should have, now's the time to get it. And remember, if you're over 65, it's the double dose that you want to get.
Dr. Callender, is it this year you talking about, or 2023? Because I thought everything that was coming out was saying that the flu vaccine, the COVID vaccine was 60% effective at the best.
No, I was talking about the flu vaccine.
Oh, okay.
The vaccine
Sorry.
last year was 50%.
Okay,
effective.
sorry.
Yeah, and this year they're saying that the flu viruses that are out there are very susceptible to the vaccine. So it's will be better than last year. Although last year was a down year because everybody was wearing masks and social isolating. So the flu was not a big problem last year, but this year expected to be different. So that the importance of getting the flu vaccine would be even more important. And even with the problematic 50%, it still protected you from hospitalizations and mortality.
Okay.
And one of the problems is that vaccinations are down, which is concerning because if the flu hits hard, then people will die. And the group that is affected is the group that is not vaccinated. I hope everybody's gotten the flu vaccine. Really.
Oh, yeah.
So it'll be interesting to see. We during the week of Thanksgiving doubled the number of admissions, and COVID hospitalizations have increased as well. But it's clear nobody's wearing masks. I just went to a meeting in West Palm Beach, Florida, and I think we had about 600 people in the meeting, and less than 5 had masks. And this is a medical meeting. Less than 5 people had masks. So it's going to be interesting to see whether this combination of RSV or flu or COVID is going to be impacted by the fact that we've gotten away from what shortened the flu season last year.
Dr. Callender, at that convention, did they discuss the mask? Because I guess people look
No.
at if the doctors don't even use the mask, and why should we?
This is a medical convention, and as I said, less than 5 had masks on, and nobody discussed it at all. So, but you know, and then in the airport, all the people, the staff, the airport staff wore masks, but almost nobody else. And it reminds us that it's a high dose vaccine for seniors. So always remember to ask for the high dose for the flu. Now, this is a frightening article in a sense because we've abandoned the things that helped us. And LA has returned to indoor mandate because they had 10,000 new cases, along with 29 deaths. So they're starting to go back to the mask mandate. Whether that will occur in other locations, I'm doubting it personally, based on what I've seen. And I think one of the reasons why it's unlikely is that more than 80% of the population is already vaccinated, but that leaves 20% of the population that is vulnerable. What are your thoughts about it?
Yeah, I just got back from a international trip, and in the airport and on the plane, I'm sorry to say almost nobody had a mask on.
What about the staff, airport staff?
the staff is like maybe 1/5 of the staff, maybe.
Hmm.
The staff on the plane did not have masks. I had mine on the whole time unless I was eating. You know, and I was okay. You know, traveling on the plane, but in the airport, nobody.
Yeah, it's kind of, well, we'll see. We'll see what happens. See what happens. I keep wearing mine, so.
I have a performance on Sunday, and all the choir and the orchestra has to have masks on, and we have to get temperature checked in order to get into the church. That's like all the time.
Yeah, I noticed some of the choir members who sing with their masks down. And so it's interesting.
Yeah, I went to church Sunday as well, and they coming into the church, you had to do your hands and they took your temperature. But once you got in the church, it was maybe a mask, maybe not. It was a few.
Really?
Not.
Our church still requires a mask.
No, this particular church didn't.
Hmm.
So.
No.
Mhm.
What about some of your others? Your churches still require masks?
John, I
My
think
church is
My church
optional.
still has masks.
Yeah, my church is optional.
Optional. Hmm.
Yeah.
all the church staff had masks on, but they didn't require that the people did.
Oh, okay. That's
I-
interesting.
My church require masks.
Yeah.
I'm at 4 different churches and they all require masks. So, now lately the choirs that I'm playing for, they'll take their masks off to sing. And then after they get through singing, then they put their mask on. And the minister that is preaching, he takes his mask off to preach or give announcements, and then he puts it back on. So they're generally following the same routine. But everybody that's in the congregation have their mask on.
Hmm. Okay. The bivalent vaccination seems to be desirable, seem to be working. So it's going to be interesting to see what happens in January, February, and March. This is an interesting article that talks about isolation and the impact it has on teenage brains, although saying it's 3 years older than teenagers, that I didn't think that was that remarkable, but researchers did. I mean, to say somebody's 15, the brain looks like 18. I mean, you know, that's still pretty young. So,
Dr. Callender, there were 3 teenagers that died from fentanyl overdose recently. Like I'm talking about within the last several months.
yeah, fentanyl is still killing people of all ages. Sad to hear about. One of the things is that many of the people don't even know that they're receiving fentanyl till they don't wake up. We know that in the teenagers, anxiety and depression is increased dramatically. And we think this is related to the isolation that they have been associated with.
Dr. Callender, 2 of them were found at home and one was found in a car in the apartment complex that they lived in. One of them died at Hyattsville High School, and that's where my son teach. That particular one died about 10 months ago. And so I think he started working around 10 months ago, didn't he, Carol? Carol must be gone. But anyway, yeah,
Muted.
that's sad if they died at home. Well, I mean, it's sad if they died anywhere, but at home, I think is a bit different from out in the car.
Mhm.
So you're talking about locally, right? This is an
Yeah.
epidemic in LA. They're all over the streets, all over the street corners. People smoking fentanyl, and they can't stop. So they just keep doing it until they die. It's very, very sad. There
Oh
was a-
my goodness. These three cases that I'm talking about are in this particular area, you know, like Prince George's County and the counties in Virginia.
I'm sure there's a lot more than 3. That's for sure.
Oh, yeah, yeah, yeah. Okay, let's go to the next one. Now, this is a real tragic article that looks at people who have long COVID. And they find that the system is not ready.
Hmm.
And they talk about the fact that we don't really have good treatment for long COVID. And we don't have clinics that address long COVID. And so rejection and long waits, and then no appropriate treatment. So it's one thing to have COVID and get over it. But for those who have lingering brain fog and other such conditions, headaches, lung fibrosis, and other things, it's a very sad situation because we don't have the medication to treat it, and we don't have many clinics. You look at 4-month waits for clinics visits, that's a huge time to wait. So it's an issue that got 16 million adults with long COVID, but we have not set up a system that addresses it satisfactorily. So we've had over 1 million Americans die from COVID, and now we have 16 million Americans living with long COVID, and we haven't developed a system that effectively takes care of it. Do you know anybody with long COVID?
Yeah, my cousin Rodney still has some long COVID symptoms. He calls it COVID brain forgetfulness.
Is this the one who was on dialysis?
Yes.
Has he had a transplant yet?
No, he's off dialysis and is
Oh, wonderful. Oh, good.
he's looking for a kidney, but he doesn't require dialysis right now.
That's good. That's good to hear.
I have a neighbor with long COVID, and he still can't taste or smell, and he's losing a lot of weight because he doesn't want to eat, and he doesn't sleep well, and he is very forgetful.
Yeah. Boy, it's tough.
What's his age?
60.
Do you know if he was vaccinated?
Yeah, he was vaccinated. He got COVID. He was a mailman. So
Mhm.
he was one of the first people to get COVID, and he recovered. And then he got the vaccination, and then he caught COVID again. And this is the second time.
Mm.
He
Wow.
got caught in between vaccines, but he's gotten vaccines and everything. But he was my walking partner, and he's reluctant to walk a lot. But I try to encourage him to walk and try to not let him discourage me, because at one point when he didn't walk, I wouldn't. I said, oh well, let me make myself. I'm gonna encourage him if I can't encourage myself.
Mm.
So he's not getting good. I don't think he's getting good treatment. His doctor kind of dismisses him.
Well, that seems to be a general situation because they really don't know how to treat it. That's one of the problems.
Well, just let me say for the record that Joe Biden is the current president and the year is 2022. And my name is John Tatum, and I'm at the Capital Region Hospital. How about that?
Okay.
You got it.
Yeah.
Okay. Let's go to the next one. That's a little more cheerful than this one. It's depressing. Now this may be even more horrifying. Is that this is in the UK, so that's why I included it. I didn't want to frighten anybody. It's not in the United States, but they told a number of people who were COVID positive that they were negative, and so they spread the disease, and also 20 people died because they were told that they were COVID negative when they were COVID positive. And not much you can do about it. It's the lab made a mistake, and people have died as a consequence. And I guess there's always a chance to get false negatives, but false negatives are very costly. Because the people who are positive, who are false negatives, can either die or they can spread disease. So it's double whammy.
And also there are petri dishes for new viruses. You know.
Yeah, yeah. So that's disconcerting. As is this article, the new COVID wave, because we're talking about COVID is over. But look at this data that says something different. Hospitalization jumped 25% in recent days. Positive tests. And remember last week we talked about that most of the people who are dying from COVID have been vaccinated. So we have an issue that makes us very uncomfortable to relax and get away from masking and social isolation. But in point of fact, the virus is still with us. When we look at the numbers, see that we still have daily new hospital admissions, and we still have deaths. And remember last week we talked about the group that was most affected by mortalities, were the middle-aged group from 25 to 54. And the senior group, which previously had been affected most of them are vaccinated and are safer. But what does it mean is the question. It is tragic that we would like lower than 70 in world countries. It's the richest country in the world, lower than 70 world countries. That's kind of frightening. And that figure of less than 15% who got the bivalent vaccine is horrifying. So the vaccines are preventing hospitalizations, but what will happen when we get cold weather and holiday gatherings? That's the question. We saw what happened with Thanksgiving. What's going to happen with Christmas and New Year's? And then, of course, we have the groups of immunocompromised people. So it's more than a notion that the COVID is still with us. And to think that we have more COVID cases than any place in the world, and yet fewer people have received the bivalent vaccines is kind of scary. Any comment or thoughts about these data?
I think you said it best. It's just scary.
Yeah, it is. Yeah.
Just keep wearing your mask. That's what I say.
And the point they're making here also is that the previously effective monoclonal antibodies for the other variant was useful, but not anymore with the new variants. So that monoclonal antibody is no longer effective. And Paxlovid works. Of course, it's has a long list of drugs you can't use with it, but it is effective. Probably the only thing that is effective for the new variants. So what are we going to do about this situation where we got RSV, we've got flu, and we've got COVID. So we had to be mindful of this as we go into the holiday season and be sure we're vaccinated for the flu and COVID and so forth. Any comments on this?
Are they working now on a new vaccine for the new variant?
I haven't seen any activity. I'm sure they are, but I haven't read anything about it.
Mary Ellen is doing a test on one of the new vaccines. I mean, the
That's the
vaccine
RSV.
for the new virus. Yeah.
That's RSV because they don't have a vaccine for that.
No, they don't have one. But what the answer to the question is, are they working on something? And according to Mary Ellen, they're working on her.
Yeah, but I thought that was for RSV, not for COVID.
Yeah, that's for RSV. I just got the shot yesterday.
Yeah, that's for RSV, not COVID.
I was talking about the COVID. Yeah.
Oh, I'm sorry. I was talking about the RSV.
Well, it's going to be interesting to to see, we'll learn a lot about the triple viral.
Got to call the water to be open 4 hours.
Yeah. Although the news is good for the
I got water.
fact that the flu virus is great.
One time.
It's very interesting to see what happens this winter. Okay. The question is, what happens in 2023 when the government stops paying for the vaccines? Or will COVID, or will the president ensure that that it's covered? I suspect he will. So let's hope that that's the situation.